I think in some ways I did a very traditional pathway. I went straight through school, straight through training. But there's other ways to do it and other opportunities to learn about fellowships. So um, I did an NIH fellowship for a clinical fellow after residency, a graduate medical education approved fellowship, but there's other fellowships at the NIH. There are student um, opportunities for summer internships for high school through graduate and professional school opportunities where they have paid interns come to one of the NIH labs at the clinical center to do fellowships. And I guess in addition to the summer internships, there's the Medical Research Scholars Program for medical or veterinary students. And that's a year-long program where they take time off during their medical training to do research at the NIH. For research graduates, recent graduates, so either recent baccalaureate, post-bac graduates, or postmaster's degree graduates, there's a it's called a post-bac IRTA, or Intramural Research Training Award, where there's 1 to 2 year research experiences that you can have in a lab at the NIH. And then for residents and fellows, there's clinical and electives and fellowship opportunities, and then for staff and professional education opportunities for people who are beyond training, who want more training on the responsible conduct of research. As I mentioned, I did my infectious disease fellowship at the NIH. Many institutes at the NIH have post-residency fellowships that are similar to a fellowship that you can find at a big hospital like Tulane. So I could have done my infectious disease fellowship at Tulane or at WashU, or Howard University has it. So there's many places to do an infectious disease fellowship. They can have, and there's other fellowships in oncology, in endocrinology, in critical care medicine, many different surgical fellowships, radiology fellowships, many different fellowships. And you do your clinical training as well as research, and you can do your research either at the bench or in the clinic, and you can learn how to do clinical research. There's courses in clinical research that I've listed there.
There is cost associated with it. So generally, if you do a PhD, it's usually paid for. Master's degrees are not typically paid for, but PhDs are. But the idea of a PhD is that you're actually working as well in research. So usually the tuition is paid for, but the idea is that you're participating in research and having it paid. But there is what we would call kind of lost opportunity, like what Dr. Talat did. Going into a fellowship means she wasn't earning the big doctored bucks for for a few years, right? So you can look at that as lost kind of salary opportunity, but you're still being paid to be a student to learn as well. So there's two ways that you can look at it.
Yeah.
And there are funding models, even at the master's level, which I'm going to talk about, that a lot of the students in here are eligible for that you wouldn't think you were eligible for. So as we go through those slides, I'll tell you about other funding mechanisms to help you get paid to do what you want to do. If you want to do research, it doesn't have to always come out of your pocket.
Yeah, it's the former dean of my school used to say that the best master's degree is a free master's degree.
Yeah.
So finding somebody else to pay for it. And I have to say that unless you're working for big pharma, big drug companies, there's the reimbursement in clinical trials is not what you would get if you were a clinician working in your field, no matter what your field is.
Right.
So the other thing is it's really important at all stages of life to
Have a good
find a good mentor. And this could be an official mentor, this could be an unofficial mentor, it could be somebody you just bond with and you want to and you ask questions of. But mentorship is the process by which a more experienced or a senior person gives guidance or advice to someone more junior, and the mentor can serve as a role model. The goal of a mentoring relationship is to help an individual grow and accomplish their goals, and you help them. For example, like today, somebody asked me, well, I got this email asking me for the material that I created. How do I respond to it? I don't want to give it away. How do I respond to it? So they could be something like that. Or there is this job opportunity. Should I apply for it? Or what do I need to do in order to make it to the next level? And a mentoring experience may provide professional career development and support, role modeling, and psychosocial support. Sometimes you just need to talk to somebody about what you're going through. And mentoring relationships are personal and reciprocal. I've been so fortunate to have so many mentors in my career, starting with, this is my high school science teacher who pushed me to who recognized my love of science and nurtured it, to the first person whose lab I worked in as an at the University of Washington when I was a high school student, my college lab mentor, to people who I work with now on a daily basis who aren't necessarily my official mentors, but help me along in my career and give me advice, and who I consider my friends as well as my mentors. And so, really lots of people, both in an official capacity as well as an unofficial capacity, have served as my mentor. And you don't have to have, very few of these people were assigned to me as a mentor. Like, this is my fellowship mentor, but I chose him. But his role towards me was formalized. He was the person who I reported to. But everybody else on this line were people who we didn't have an official mentee-mentor relationship, but yet they mentored me. This person, Sarah Bennett, is my official mentor at Hopkins, but so many other people have mentored me along the way. So it's incredibly important to, and I've never gone to them and said, will you be my mentor?
Right.
But
Yeah,
these are
not like
people
that.
for whom our relationship has been one where they have given me advice and helped me grow as a professional.